I'm Ben Peterson, Guidance and Support Specialist at Augma Biomaterials. I'd like to welcome you as new users of our Bond Apatite cement. Bond Apatite cement can definitely be considered as the next generation of dental bone grafts. It is completely different from the existing Me Too products that are already on the market. Unlike granules and putties and blocks, which are cumbersome to work with and always require membrane coverage, the cement properties of Bond Apatite make the handling and workflow so easy, so friendly, and so enjoyable. And of course, with Bond Apatite, the outcome is a far better one. So Bond Apatite will make your work more comfortable, it will save you time, and it will reduce your expenses. However, we must keep in mind that working with cements is a different concept that we must address differently. It's like driving a car instead of riding a horse. We must learn and practice in order to understand how to make this shift. Now, there's definitely a short learning curve to overcome, but those willing to adapt to this technique will experience the tremendous advantages that working with cements offers. In order to facilitate this transformation, I'd like to share with you a brief 5-minute hands-on training that might be very helpful and useful to you. My hands-on training will be divided into 3 parts. First, how to activate the material. Second, what indications we can use it on. What indications at first and which ones later on. And third, the radiographic appearance during and after healing, which is completely different from other bone grafts that do not become replaced with the patient's own bone after resorbing. Now, let me show you how to activate the material. First, what we're going to need to have ready. We're going to need our Bond Apatite 1 cc syringe, some dry gauze, some gauze wet with sterile saline, and that's about it. Now, it's important before activating the material that we have our defect area fully prepared, both in terms of soft tissue and hard tissue. Now, we take our Bond Apatite 1 cc syringe, and the first thing we're going to want to do is give a couple of flicks of the finger towards the cap area. And what this does is it disperses the powder so it's able to be activated properly. Now, let me explain a little bit about the syringe. Here we have 2 compartments. In one we have our Bond Apatite powder, and in the other compartment we have our sterile saline. They're separated by a piston, and what happens is when I push the plunger forward, it's going to combine the 2 compartments and it's going to give us the perfect viscosity cement. Now, it's important before I push the plunger to cover the cap with my finger so it doesn't fly off as I'm pushing the plunger down. Now, as you see, as I push the plunger in one continuous action towards the blue line, the saline starts to mix with the powder, and as I get to the end and I start to feel maximum resistance, the excess saline gets pushed towards the back of the syringe, and now that I feel maximum resistance, I know I have the perfect viscosity cement. I remove the cap, and I go ahead and I eject it into the graft site. Now, you see already it sticks to the bone. It's very comfortable to work with. The first thing I do after I eject the Bond Apatite into the defect is I take dry gauze and I give a 2 to 5 second compression with my finger. Now, if I want to shape, I can do so. And again, after shaping, another 2 to 5 second compression with my finger with dry gauze. Now, the only thing that's left to do is take our wet gauze, place it over the graft, and have the patient close their mouth passively for 2 minutes. Then you would go to proceed to membrane placement if the indication requires, and to soft tissue closure, and we are done with our graft. Another important point to remember, because the material is cement, when using it in a defect that has 4 bony walls, such as a socket, it's very important to use dry gauze and your finger to give a 2 to 5 second compression. Do not use a tool to push the material and compress it towards the apex as we're used to doing with granules. This can lead to dry socket feelings of pain for the patient. Now, some questions that might arise are, do we need a membrane? Is there volume shrinkage during healing? How much time do we have to wait before placing an implant? Can we augment simultaneously while placing an implant? How is the radiographic appearance? And in which clinical indications can we use this graft? So let's get started. Do we need a membrane or not? We definitely recommend that in your first 5 to 10 cases working with Bond Apatite that you do place a membrane as you're used to. However, due to the cement properties, after gaining more and more experience with the material, in small to medium-sized defects, especially those with at least 1 bony wall support, can be done without a membrane. It will be left to your discretion later on whether to continue to use a membrane in such cases or not. However, in larger defects, for example, when the size of the defect is larger than the space of a 3-tooth area, let's say, or when long-term stabilization is required, we do recommend that you use a membrane, and of course to stabilize it with traditional methods such as mattress suturing and pins. Again, primary closure, soft tissue stabilization, and a proper suturing technique are always important whether you're using a membrane or not. The second question that might come up: does volume shrinkage occur during healing? The answer is yes. Volume shrinkage of about 15% is common. That's why it's important that you overfill the graft with 2 millimeters of material in small to medium-sized defects, and in larger defects even more. Moving on to our third question: how much time do we have to wait to re-enter and place an implant? Given that the biphasic calcium sulfate is 66% in volume within the graft and is resorbed and replaced completely with the patient's own bone simultaneously, 3 to 4 months is usually sufficient time to re-enter and place an implant. And for our fourth question, can we augment together while placing an implant? The answer is definitely yes. However, the implant has to have good primary stability from the bone and not from the graft. The fifth common question that we will answer is about the radiographic appearance. Now, because bond apatite is a composite graft made of 2 different matrices, each with different degradation behaviors, the radiographic appearance is completely different than that which we are used to seeing. Immediately after placement, it appears radiopaque. Then the degradation of the biphasic calcium sulfate matrix takes place, and already after the first week, we will see radiolucency in the borders that will consecutively enlarge up until the 4th week. At this stage, we'll see some floating radiopaque points from the HA particles within the radiolucent area of the transformed BCS. The radiolucent area is actually the new osteoid before calcification. Later on, up until the 12th week post-op, the calcification process occurs, and we will see very clearly the radiopacity of the trabecular form of new native bone. And finally, our last question: in what indications can bond apatite be used? For your first cases working with bond apatite, you might start with socket preservation, with or without immediate implant placement, ridge preservation, dehiscence, or fenestration cases. Other cases that you might use the material for include closing the window of a sinus, lateral augmentation, periodontal defects, filling voids after cyst removal, episectomies, and in cases of bone split and crest widening. Vertical augmentation cases and peri-implantitis cases are not recommended, at least in the beginning. Their predictability is questionable since there are many other factors at play which could affect the outcome. So we must keep in mind that as with any augmentation material, the conventional surgical rules such as thorough debridement, primary closure, and a proper suturing technique must be respected for the success and predictability of the treatment. I'd like to thank you for listening today, and I'm certain that you will enjoy your experience working with bond apatite. For additional information, please visit our website, www.augmabio.com.